Hello, everyone, and compliments of the season. I pray this year is kind to all of us. Have you always wanted to give back to Nigeria, but did not know of a reputable organization to work with? Have you ever considered supporting the health, education, and development of children and also the health of adults in the community with expectations of nothing in return? My name is Bim Akintade, and I am the founder of Health for Nigeria. I founded the organization in love and memory of my mother, late Mrs. Gladys Mowaninola Akintade, who passed away in 2000 after a heart attack which could have been prevented. I'm sure we all know a family member or loved one or a friend who experienced something similar. I would like to provide a way for you to do something meaningful regarding the health, education, and development of children and adults in Nigeria. Health for Nigeria is a nonprofit organization registered in the US and a non-governmental agency registered in Nigeria focused on achieving health equity for all Nigerians around the country. We aim to support local communities by providing healthcare services for constituents in creative, innovative, and sustainable ways. Health for Nigeria brings together like-minded and passionate Nigerians in the diaspora and also in Nigeria to work on tackling the healthcare problems of Nigeria one step at a time. Health for Nigeria hosts activities in the healthcare space. These activities include a healthcare leadership and management program. We're currently working on a 12 to 24 month leadership and management program, which is currently under construction. Once it's available, I'll be glad to provide more information. Panel discussions. We gather leaders in the healthcare space to discuss pressing topics in healthcare and education in Nigeria and around the world. These are usually free and open to the public. Monthly lecture series. We invite guest lecturers to speak to our nurses and an open audience on various health and other professional topics. These lectures are free and open to the public also. Monthly newsletter broadcast. The first week of every month, we broadcast our monthly newsletter to all our stakeholders. This provides updates on our activities for the month. We also highlight our donors, sponsors, and partners. Educational and promotional videos via the Smiling Nurse. We put out educational videos on various topics from health and hygiene to depression and nutrition. You can find all our videos, including our past lectures, on our YouTube channel. Just type Health for Nigeria Foundation in the YouTube search bar. I'd like to spend some time talking to you about Health for Nigeria's flagship program, the Nurses School program. The Nurses School project was envisioned in July 2020 and established in November of the same year. The goal of this program is to fill the healthcare gap in rural public schools and communities around the country. We accomplished this by setting up clinics in rural public high schools and deploying registered nurses to the schools in underserved communities. We have 5 main objectives to drive our impact within this project. COVID-19 education and resilience building. Our nurses are trained to provide general education and awareness to the students and staff on the most recent national and global protocols for COVID-19. Basic first aid provision. One of our most important objectives is to ensure that students and staff of each school have access to basic first aid services as the initial point of care. School Health Club. Another key part of the Nurses School program is establishing a school health club for promoting and fostering health education and awareness in the students at the school. Student home visits. Our nurses are dedicated to ensuring the students have positive academic outcomes. That includes making home visits for students who have been ill to educate parents and caregivers. Community engagement. An unexpected but very welcome and supported outcome of the Nurses School program is that our nurses are becoming healthcare leaders in the communities they work in. Our impact so far. The Nurses School project has been operational since November 2020. During this time, we've established sick bays in 7 schools across 4 states in Nigeria, with 3 more in the works. We've hired nurses in each school to provide healthcare services to over 7,000 students. We've been engaged in 8 local communities in Oyo, Ekiti, Osun, and Ondo states. We've provided health education and health screenings for over 1,000 people in the community. We've also signed agreements with participating states to establish sick bays in their state public schools. We need your help, and that's the purpose of this message. Success is the sum of small efforts repeated day in and day out, according to Robert Collier. There are 5 ways to support our vision in the Nurse to School program, and I'm going to share all 5 ways. The first way is to sponsor a program. Sponsoring a program includes Health for Nigeria approaching a secondary school or a high school in a local rural community to partner. Once a space is provided to us to be dedicated as a sick bay, we go ahead and basically refurbish the space, which includes tiling the floors, painting the walls, fixing the ceilings, installing windows, doors, whatever it is we need to do to make sure it's a safe and effective space to be used as a sick bay. In addition, we provide furniture and other healthcare equipment necessary for the nurse to be able to see not only students, but also faculty and staff. We then proceed to fill our sick bay with all the necessary equipments, both disposable and non-disposable equipments. We recruit, we hire and train a registered nurse who is hired to be present every day at the school, and their salaries are paid for an entire year. To sponsor a program, the cost is about 2,250,000 Naira, which is about the equivalent of $4,000. The sponsorship of a program could be done in an individual's name, in the name of a family, in the name of a business, in memory of a loved one, and it can also be done anonymously. The second way is sponsoring the sick bay, which is basically doing everything except for the recruitment, hiring, and training of a nurse. So once again, we would partner with a local rural high school, and once we identify a usable space, we would renovate the space, which includes tiling the floors, fixing the walls, painting, fixing ceilings, installing windows, doors, creating storage spaces, providing all the necessary furniture and equipment and all the medical equipment necessary to turn the space into a clinic. The third way is sponsoring a nurse, which includes paying a nurse's salary every month, and this is the equivalent of $100 a month. This is actually very popular. We have several individuals who've committed to doing this, and we would love the opportunity to work with you in something similar. The fourth way is a personal hygiene kit. So we've identified very simple ways to improve upon the hygiene of young boys and girls in this age range. So if you take a look at the personal hygiene kits, they're very similar. The difference is the inclusion of sanitary towels for girls. And this ranges on average between about $12 to $14 for the kit. And if you think about it, our schools, from the smallest school, we have over 200 students to the largest school that houses over 1,500 students. So we would like to make this available to as many students as possible. And finally, we would like to partner with you. So do you own an NGO in the US or in Nigeria already providing similar services? Do you participate in food and other material giveaways? Are there services you provide that may be beneficial to our nurses or the children or members of the communities we serve? Do you have ideas for additional services we should consider? We're still learning. There's so much to do. We would love the opportunity to hear from you and hear other brilliant, imaginative ideas you have. And finally, are you willing to volunteer with Health for Nigeria to support our work? We would love to partner with you. Either one of the previous 4 ways, or if there's a way to partner with you to make Nigeria a better place, we would like to work with you. So how can you contact us? Well, to become a sponsor, a donor, or a partner, you can reach us at info@healthfornigeria.org, hfnfoundation@gmail.com, or you can email or call or text me at 240-354-4977. You can also check out our website at www.healthfornigeria.org for additional information. There's a saying that vision without action is merely a dream. Action without vision just passes time. But vision with action can change the world. Please join us as we make a very small change in our beloved country. We know it's a change for not only positivity, but it impacts the lives of not only children, but also adults in these rural communities. Thank you very much, and we look forward to you joining our cause.